As you may have seen, Tiger Woods has announced he's undergone a fourth back procedure dating back to March 30th, 2014. This time, a spinal fusion procedure between the L5 and S1 vertebrae. And all of that sounds really complicated. So we wanted to kind of give you a sense of the surgery, what's performed, what was done, at least as best as we know it, and what that can mean for his recovery and success moving forward. So first we wanted to tell you about the surgery itself. In this case, brings together the L5 and S1 vertebrae, cutting out the disc, the kind of squishy, rubbery stuff between your vertebrae, the bones in your back, in your spine, and what it does is makes them into a single vertebrae, healing together using this fusion procedure. So Woods has had previously 2 microdiscectomy procedures where a surgeon has cut out a piece of the disc which has been causing some kind of discomfort or pain, typically nerve pain, and that typically happens in the sciatic nerve, which runs down the back and into your legs through the lower portion of your body. And so in those procedures, the idea was to cut away a piece of that rubbery stuff so that his back functioned better and he walked and performed with less pain. Unfortunately, over the course of those 2 procedures and a third procedure, which Woods has never truly detailed, the space between those 2 vertebrae, the L5 and the S1, with that disc has grown so narrow that it has caused further pain, more back spasms, and more sciatica. And so that precipitated this 4th surgery in Texas at the Texas Spine Institute. And so what happened in this procedure was the doctor that went through the anterior portion of Woods' body. So the posterior is your butt. The anterior is the front of your body. So what they did is they made a 3 to 6 inch incision just below Woods' belly. And they went in, they pushed the abdominal muscles to the side, one way or the other, pushed the organs to the side, one way or the other, pried him open, and gave them clear avenue to go to the back. From there, they cut out the disc between the L5 and the S1 vertebrae, took out that, and then to rebuild the space between the L5 and the S1, they had to create that kind of spacing using other means. Now, when they do a spinal fusion surgery, they have a couple of different choices. They can use bone, so they could cut out bone from other places in Woods' body and bring it in to fill in that gap, fusing them all together, typically with screws. Or they could use metal throughout, building up that gapping with metal, which over time can corrode and become less stable and could create problems that lead to more surgeries. However, Woods is a typical candidate for a surgery like this. Woods' bone strength has shown issues over the years, particularly in his back and his legs, and the typical age for someone who gets this kind of spinal fusion, the L5-S1, according to research that we've seen, is someone in their lower 40s. Woods is 41, he'll turn 42 in December. So he fits the profile of someone who has back problems, who needs this kind of surgery. And there's a decent chance that having the 2nd microdiscectomy and the 3rd procedure, whatever that turned out to be, likely precipitated this surgery in the end. So now what we don't know moving forward is what the fusion looked like and how well it'll hold up and how well it'll heal. However, the history of this surgery does tend to leave a positive outcome for the potential future of the patient, with 80 to 90% reporting in a lot of studies that their pain has gone away, if not entirely, drastically, which is good for Woods' quality of life moving forward, as a dad, as a person, as someone who just wants to live their life without having to worry about whether they can stand, sit, or lie down. The downside could mean that having the spinal fusion procedure instead of pursuing something like a disc replacement surgery, that could mean that this could limit Woods' future as a golfer moving forward. However, as Woods' website stated and as his doctor recommended, this could be a 6-month recovery time to getting back toward normal activity. That's stuff that we do every day. What that means for his golf life moving forward, his career moving forward, remains unknown, and I'll have to see how his spine fuses together and how that heals over time as to give an indication of when he could come back and play again, what that might look like, how he'll perform physically, and if he'll even be able to do it. But the surgery seems to have been a success. It seems to have been one that's fairly commonly successful, so those things are good news for Woods moving forward. For Golf News Net, I'm Ryan Bellinger.